Hi, my name is David Souleles. I'm the COVID-19 Response Team Director for the University of California, Irvine, and I'm happy to be here today to be able to talk to you a little bit about COVID-19 and the current state of the pandemic in the United States, as well as the good work that our program in public health has been able to do to contribute to responding to COVID-19, both here in Orange County, but also contributing to academic research that will lead to improvements in public health practice over time. So with that, we'll go ahead and get started and talk a little bit about the current state of the COVID-19 pandemic. Nationally and in California, case counts and hospitalizations have been declining since the holiday surge that I think we're all very familiar with and have witnessed. And it was very difficult and challenging surge, and the highest surge we've seen since the pandemic began. But we seem to be coming off of that surge with daily case reports declining. As an example, at the peak of the surge in California, roughly 50,000 new cases a day were being reported. And here in the early days of February, we're at about 10,000 cases a day. Similarly, here in Orange County, we've seen daily cases and testing positivity rate, hospitalizations, and ICU admissions also declining. At the peak of the pandemic here in Orange County, this last surge, holiday surge that we saw in between Thanksgiving and the mid to late part of January, we were seeing upwards of 5,000 cases a day in Orange County, and now we are hovering around 1,000 cases a day, give or take, on any given day. So definitely improvements in the number of daily cases. Our hospital admissions are down, our ICU admissions are down, and this is all welcome news given the really difficult time we had dealing with this surge in the COVID pandemic. And while these trends are encouraging, case counts, testing positivity rates, hospitalizations, and ICU admissions still remain high in California and in Orange County. We are significantly higher now in February than we were in the beginning of fall quarter, for example. So while the news is welcome of the decline, we are nowhere near out of the woods yet in terms of needing to keep our guard up in terms of preventing the spread of COVID-19. And to that point, Orange County remains in the most restrictive state of California, purple tier of COVID-19 restrictions. And really here in California, the state has developed a multi-tier system to look at the severity of the pandemic and the intensity of the restrictions that a local county needs to put into place, with purple being the most restrictive tier. So many businesses are still restricted from, say, indoor dining, for example, and limitations on outdoor dining, limitations on number of people in retail establishments, etc., limited ability for people to gather in small gatherings. Really the tightest restrictions possible until we continue to see increased improvements in our testing positivity rate and our daily case rates here in Orange County. So we continue to really focus on those efforts here on the campus, and I'll talk about that in a few minutes. But before I do that, I really want to focus on the good work that our faculty and staff from the program in public health have been doing since day one of the COVID pandemic here in the United States to really contribute to the efforts here in Orange County and also contribute to the overall academic knowledge base as it relates to communicable disease control and pandemic management. In particular, with really a lens focusing on our experiences with COVID-19, and really under the leadership of our founding dean, Bernadette Bowden-Albala, our faculty and our students and our academic staff have really stepped up. And first, I want to talk a little bit about some of the work we've done in disparities research and training. ACT-OC is a project that's done in partnership with the Orange County Healthcare Agency, which is our local public health department. Really early on, the health department and UCI were interested in understanding how much COVID was actually in Orange County. So in the early days of COVID, we really had limited knowledge as it related to how pervasive COVID was in our community. And so using antibody testing as a way to look at anybody who's ever been exposed to COVID-19, through this study, we were able to determine that there were really elevated levels of COVID-19 in the county, really sevenfold greater than what we were seeing in the official county statistics in terms of COVID positivity rates. And we were seeing elevated prevalence of COVID-19 among Hispanics and low-income adults in our community as well. We also early on really wanted to begin to take a look at the social impacts of COVID-19 on our communities, and particularly around stigma and health disparities among young adults. And of note in this particular study that we engaged in, Asian students were 1.5 times more likely to report enacted stigma, being mocked or being avoided, and 2.6 times more likely to report internal stigma, feeling ashamed or worthless compared to non-Asian students. And Asian students reported 6 times more likely to fear being stigmatized in the future, which really helps us to understand the work that we need to do as a community to create safer environments for all of our residents and to correct misperceptions around COVID-19. The program in public health developed in partnership with the Orange County Healthcare Agency, a health equity contact tracing workshop. We'll be talking about contact tracing in a little bit more detail in a few minutes, but this summer workshop was led by graduate students to train peers, public health practitioners, community leaders, and Orange County residents to do contact tracing all through the lens of health equity, really looking at what it takes in order to be able to understand our communities and support them in their efforts to be able to safely isolate and quarantine if needed during this pandemic. In terms of some additional research that we've been engaged in through the program in public health, SERVO-C is a surveillance study of emergency responders' virus exposure. And here we were looking at that all-important question of how long do antibodies persist once somebody has been exposed to COVID. So we conducted antibody testing of participants who had tested positive previously for active COVID-19 to try and begin to understand how long antibodies persist after infection, and a total of 1,486 personnel have been tested to date, and that analysis is ongoing. The Santa Ana surveillance study was a project we did in partnership with the city of Santa Ana, looking at COVID-19 antibody testing among 3,300 residents to determine community exposure, really looking in the city of Santa Ana, which has been one of the hardest hit communities in Orange County with COVID-19, to better understand the spread of COVID-19 in the community and particular challenges and issues there. Findings from this study will be used in partnership with the city of Santa Ana and integrated into the Santa Ana Cares project to continue to support COVID response activities within the city. And then just to really point out that our faculty from the program in public health have been engaged with School of Medicine and College of Health Sciences faculty from across various disciplines to look at a whole variety of issues around COVID-19, contributing to our academic knowledge set as it relates to COVID-19. The findings of many of these studies can, I think, help to contribute to better public health practice in the coming months and years and decades as we learn so much from this COVID-19 experience to help us be better prepared for future outbreaks. And then in terms of our community engagement and involvement, a couple of really key task force participation efforts that we've been engaged in to talk about. One is the Orange County Healthcare Agency Vaccine Task Force. The aim of this task force is to address prioritization of vaccine recipients and how to address concerns about the vaccine among different demographic and workforce groups. Vaccine hesitancy is a significant concern in Orange County, as it is throughout the country, and part of the efforts of this task force are to really look at those issues and how we can best get our populations vaccinated. So public health participation in this task force has really been an important contribution that we've been able to make on behalf of the program in public health. And then the Orange County Healthcare Agency Pediatric COVID-19 Task Force as well, with the aim to provide guidance for Orange County school districts regarding COVID-19 transmission and research and testing with a focus on the pediatric population. This has been another area where our faculty have been engaged with this community task force. And these are really just two examples of a variety of ways that our faculty and our students and our staff have been engaged with our community partners in responding to COVID-19 here in Orange County. And then students are really critical for us as well in terms of their engagement and participation. And we have an Anteater Pledge Ambassador Program with student ambassadors who educate the campus community about risk reduction through evidence-based health promotion and disease prevention behaviors. Great group of students that have gone through training and really work as peer educators with their fellow students to focus on COVID-19 prevention and support the campus COVID-19 prevention efforts. And then the COVID-19 chat line. This was something the program in public health stood up early on in the pandemic to really serve as a resource for providing accurate information about COVID-19. Student volunteers serve as live chat operators to answer questions from the UCI community members about COVID-19. And then finally, just wanted to really point out the efforts of our academic faculty in the program in public health, really looking at modeling and trying to understand not only where we've been with COVID-19 and where we're at today, but where we think we'll be in the future. And we have a COVID-19 trends website that's been designed by UCI researchers and statisticians, including faculty from the program in public health. You can find that website at www.stat.uci.edu/COVID-19. And I encourage you to check it out to see what we're thinking may be coming for us here in Orange County as we progress through the pandemic. Now, focusing a little bit more on our campus-based response, because in addition to being a critical partner with community entities such as the Orange County Healthcare Agency and other nonprofit organizations, we've also had to respond right here on campus in order to support the more than 6,700 students that have been living on campus during fall and winter quarter, and the several thousand staff that are currently working on campus. While we are still largely a remote campus, we do have essential workers on campus supporting our students who are living on campus and contributing to critical research activities. And so UCI has really had to think about how we can create a protective environment for the students who are residing on campus and the staff and faculty that are currently working on campus. And so I want to talk to you a little bit about the layers of protection we've really been able to put in place on campus to help reduce the spread of COVID-19. And that starts out with our housing density. So we've decreased our housing density in campus housing. We are at a less than 50% density and everybody in single rooms. That makes our ability to isolate and quarantine a little easier, having excess housing available to be able to provide those spaces as needed. We have done predominantly online education. We've had a small number of in-person classes, but predominantly online education to reduce the opportunities for people to gather in closed room settings. We've got enhanced cleaning and sanitization for the locations that are currently open on campus, consistent with federal, state, and local guidance for cleaning and sanitation in the area around COVID-19. We have reduced building occupancy for remaining in-person activities so that while there are essential work functions taking place and essential education activities taking place, we've reduced the capacity in order to maintain physical distancing and support as safe of an environment as possible. Face coverings and physical distancing, really key. They're key in the community. They're key here on campus in order to support a healthy UCI. Hand hygiene has always been important. What your mother told you to do when you were a kid is equally important in the middle of a global pandemic, even more so, I would argue, at this point in time. So supporting hand sanitization stations and good hand hygiene has been a critical part of our response. We have a daily symptom checker, so all students, staff, and faculty are asked to log in daily and do the daily symptom checker. And if they identify themselves with symptoms, we have the ability to triage them and provide testing so that we can immediately identify if somebody is COVID positive. We also, in addition to that symptomatic testing, have asymptomatic testing available. And this is really critical because we know that a large majority of people who become COVID infected never actually experience any symptoms, but they're able to transmit to other people. So being able to do routine, ongoing testing of the population of students, staff, and faculty on campus has been critical to helping to keep our campus healthy and safe. And then contact tracing, which I'll talk about in a little bit more depth here in a few minutes. When we do identify a case of COVID-19, we need to talk to that individual and identify their close contacts and be able to isolate and quarantine so we can break the chain of infection. And then, as I said, isolation and quarantine. So being able to effectively support isolation and quarantine once we've identified the individuals who need to isolate and quarantine in order to break that chain of infection. And everything we do here at UCI is done in compliance with the California Department of Public Health Institutions of Higher Education guidance. That really is our Bible for looking at how we implement activities on the campus. And we have a very close partnership with the Orange County Healthcare Agency in all of the work that we do here on campus. So let's talk a little bit more about contact tracing because it really is a key component of our ability to keep the campus healthy and safe. Contact tracing is typically a government public health function here in Orange County. That would be through the Orange County Healthcare Agency, and UCI has entered into an agreement with the healthcare agency in order to be able to be delegated to do COVID-19 contact tracing for our UCI students, staff, and faculty so that we can really immediately be able to respond when we identify a case of COVID-19 in our population. So let's talk a little bit about how that works and why that's important. And timeliness really is important for us with COVID-19. And the reason being that it takes about 5 days between infection and the start of symptoms if you are going to be symptomatic. It's about 2 days from the time of infectiousness before symptoms occur. So you can be infectious 2 days before symptoms occur. And as we've said, many people don't experience any symptoms and can be infectious. And 3 days is the amount of time between close contact with an infectious person and the possibility of onward transmission. So for contact tracing, for isolation and quarantine to be effective, we need to be able to act quickly in order to break the chain of infection. And by UCI offering symptomatic and asymptomatic testing to its population and having its own in-house contact tracing program, we're able to act quickly. We can get test results back in 24 to 36 hours, and we can immediately, as soon as that result comes in, pick up the phone and begin the case investigation, the contact tracing, the isolation and quarantine, so that we can break that chain of infection before COVID has a chance to spread further. We have a great team of contact tracers that work with us here at UCI. We have a group of fellows from the Department of Teaching Excellence and Innovation, graduate student fellows who have been trained, as well as a cadre of full-time temporary employment services staff through UCI Temp Services. A set of graduate students who have wanted to engage with us and be contact tracers. And then we've got a great Anteater Emergency Medical Services Club. These are students interested in emergency medicine and paramedic and EMT support, and they have been a key partner for us in doing contact tracing. And all of these groups of contact tracers have taken our UCI Program in Public Health, Health Equity Contact Tracing training course in order to really be prepared to do the job of a contact tracer. And basically the way contact tracing works is we have a variety of ways that tests come into us, whether it's through symptomatic testing or asymptomatic testing for students and staff and faculty, whether it's self-reports by students and staff and faculty, or whether the Orange County Healthcare Agency first becomes aware. All of that information is fed into the contact tracing program. We are immediately able to implement and begin the case investigation, making the phone calls that allows us to isolate the case, identify close contacts, and quarantine those close contacts. Again, all in an effort to break the chain of infection and reduce the spread of COVID-19 on campus. So when we do that contact tracing, all cases are interviewed, isolation instructions are given, needs are identified with the plan to solve, and I'll talk about those needs in just a minute, but it's important that people can successfully isolate and quarantine for the duration so we really reduce the risk of further spread. Possible exposure sources are identified to help us determine if there's a risk that we need to mitigate on the campus. Close contacts are identified, and then those close contacts are called and interviewed and instructed to quarantine. So what are those needs? Well, it takes quite a bit to be able to effectively isolate and quarantine. We have a number of students who live off campus. They may live several students to an apartment or a house, and it's oftentimes very difficult to safely isolate or quarantine when there are 4 or 5 or 6 people in an apartment or a home. So we're able to decompress those housing units and provide on-campus isolation and quarantine housing for our students if needed. And then housing is able to support all of our on-campus students to safely quarantine and isolate. Thermometers are an important thing, such a small thing, but such an important part of this process, because in order to safely isolate and quarantine, you need to be able to monitor your temperature daily and monitor your symptoms. So we make thermometers available. We provide food support, whether it's through on-campus dining, delivery of food to those that have a meal plan, and we work with students who don't have a meal plan to provide them resources for ordering food online. If somebody has food insecurity, we're able to link them with our social work unit to help out with that as well. Academic assistance, mental health support, family support. Laundry is important in the midst of isolating and quarantining, if you're isolating and quarantining for 10 days or more. Medication delivery, pet care, all of these are important needs that we identify in the course of our interviews with cases and contacts, and then we work closely with campus and community partners to address these unmet needs. And it really does take the entire institution to support contact tracing and case investigation and isolation and quarantine, from human resources and the Center for Occupational Environmental Health on the employee side, helping to support our case investigation and contact tracing efforts, to Student Health Center and residential life and campus social work, dining services, to help us support our students through isolation and quarantine. We have a special relationship with campus athletics to support our athletes in safely training and competing. And then, of course, UCI Medical Center and UCI Health that really supports all of our COVID-19 testing that is really fundamental to our ability to successfully manage COVID-19 occurrences on campus when they do occur. So that's really a look at what we've done on campus to support our students and our staff and faculty being on campus in fall and winter quarter. We're looking forward to spring quarter and the fall and what's next and what's to come, really. I think many of you may know by now that President Drake has announced the intent of UC to return to in-person instruction in the fall quarter. COVID-19 vaccine is going to be key. The level of vaccine uptake in our communities will be really key for what in-person instruction looks like in the fall. And in particular, we're working to determine the public health measures needed for fall quarter. So what does housing density look like? What do our testing program look like? What level of contact tracing will be required? What kind of policies do we need for face coverings and physical distancing and the enhanced cleaning and sanitizing other mitigation measures. These are all things that UCI will be looking at in the coming weeks and months as we think about returning to instruction in the fall. I would just bring this talk to a close by encouraging all of you to be vaccinated when it's your turn. Take the shot. Take the shots. It is really key to this country and California and here in Orange County and our campus exiting the COVID-19 pandemic and returning to a level of in-person instruction and interaction that we were all used to pre-COVID-19. So with that, I'll bring this talk to a close and thank you all for your time today. If you'd like to know more about UCI and our efforts around keeping the campus safe and healthy, I direct you to our website at www.uci.edu/coronavirus. Thank you.